Dr. Schreier yields back. The chair recognizes the gentleman from Texas, Mr. Pfluger, for 5 minutes for questions.
Thank you, Chairman, for saving the best for last and letting me wave on to this committee. I appreciate it. And I think the witnesses, I represent a district, it's rural. We have about 3 or 4 towns that are about 100,000 people, so in West Texas. There's not a single event or a town hall or meeting with constituents that I don't go to where the cost of healthcare is not brought up. It's obviously a concern, so I appreciate you being here. I'll start with Dr. White. Just looking at the demographics, the expanding, especially elderly demographic that we have, in our country, and also an expanded demand for healthcare. What can you tell us about the observed escalation in healthcare expenditures, and to what extent is that demographic going to provide maybe a bubble of cost to our country?
Thank you for the question. So in the Medicare program, we're in the middle, maybe getting toward the flattening point of the baby boomers aging into Medicare. That's a huge driver of increase in Medicare spending. In terms of growth in per enrollee federal subsidy costs, Medicare is actually lower than for employer-sponsored insurance. With employer-sponsored insurance, growth in the prices paid to providers is driving up the per person subsidized costs. So in Medicare, demographics are a big deal. Eventually, the baby boomers will have aged into the program, and that will level out.
Thank you. Ms. Martin, for you, in recent years, the bipartisan commitment has been to achieve the substantial transparency in healthcare pricing for patients and payers. And can you kind of clarify how the enhanced price transparency can contribute to the reduction of cost?
Yes, I think opacity certainly hasn't served us well over the past few years. So just having understanding what is driving costs, how money is flowing through the system, can help public and private decision makers understand cost drivers and to design interventions that can rein in healthcare spending.
Thank you. Dr. Ippolito, when employers choose a health insurance plan for their employees, they sometimes lack the insight into the payment negotiations between the hospitals, the providers, and the insurers. Does this limited information impede employers from selecting cost-effective and high-quality care options, and could making prices more available to the employer empower them to negotiate lower prices?
Yeah, the short answer is yes. If you give the informed consumer, in this case the employer, better information about what they're choosing, they have a better ability to cost shop against competing plans, I think they're going to make a better choice and save money.
I'll stick with you for just a second on hospital costs and how some, whether it's vertical integration or mergers and acquisitions or the purchasing of using organizations to maybe purchase physicians groups and practices. Talk to us about how that's contributing to the escalation in prices.
Well, one part of that story is very easy. Horizontal consolidation, hospital buying a hospital, clearly increases prices, and it doesn't seem to have a major improvement on quality metrics. The vertical side, a hospital buys a doctor or an insurer buys a PBM, is a little bit more complicated, but there are certain risks, namely that you might steer patients to other parts of your own entity that may or may not be in their best interest, for example. So those are the kind of things we know less about in the research world, but those are the kind of things that we would worry about in those settings.
Is there a rural aspect that is maybe over-exaggerated in that?
I think rural areas tend to have a more fundamental problem, which is even in the best case scenario, there might not be that many hospitals in the first place. There might not be that many doctors. And so, yes, these types of issues tend to be a little bit more exacerbated in those areas.
Okay. And I'll finish with Ms. Tripoli. In your testimony, you mentioned that there are few truly competitive healthcare markets left. And I think you said with 95% of metropolitan statistical areas having highly concentrated hospital markets, nearly 80% of MSAs having highly concentrated specialty physician markets, and 58% of MSAs having highly concentrated insurer markets. What measures are necessary to enhance the competitiveness? And then if you can also focus on the rural side, I've got 30 seconds left.
Sure. I think as we've been talking about, price transparency, unveiling prices, forcing the market to compete on fair prices, and quality of care is critical. Reducing some of the broken incentives that incentivize higher cost care and our incentives to consolidate. Addressing the markets and the condition around anti-competitive contracting practices, things that anti-steering measures are really important to increase competition in the market, among other solutions.
I think the witnesses, Mr. Chairman, thank you for having me.
Thank you. The gentleman yields back to